And so without further ado, Doctors for Cannabis, little congressional testimony with Dr. David Nathan. You want to come on up? Thanks for joining us.
Hey, thanks for having me.
So I want to give a disclosure. He went to Princeton. Please don't hold it against him. It's
Never
really
left.
a psychologically challenging place, and we try our best.
Didn't used to be.
Well, now it is.
Now
So
it is.
I was trying to give you some
Great
cover.
deflation.
I was trying to give you some cover.
No, I graduated in 1990. It was easy back then. Yeah. They made it hard before you got there.
Just me then. Just me.
Yeah,
Okay,
yeah.
don't judge me then.
Yeah.
Too late for that. So, I know who you are. You've spoken at one of our events before, but many of the people in this crowd do not. So, who are you?
I am David Nathan, I think. I have ID, but I'm David Nathan. I am originally from Philadelphia. I got my undergrad degree at Princeton and did my medical school in Philly, and then did my residency up in Boston, where I met my lovely wife, who happily came with me, which I really appreciate. So thank you. I also want to give a shout out to Tanya Adams, one of the spokespeople for the organization that I'm going to talk about. I guess people already know her. Great. Yes, Dr. Tanya Adams, who actually spoke on DFCR's behalf a few times, including on a news show in New York City that I remember watching. So that was great. You crushed it. Crushed it. So I am a psychiatrist, and you might wonder, what's a psychiatrist doing here? Oh, he must be an addictionologist. No, I'm not, actually. My specialty is bipolar and psychotic disorders, which actually has come to be something of an advantage because I can speak to one of the controversial issues about cannabis legalization, which is the potential for inducing psychosis in vulnerable individuals, which I'm happy to talk about. So I am somebody who is a history and science wonk, and I've written on a variety of topics over the years. And one of them in 2009, 2010 was an op-ed for the Wall Street Journal about the wisdom of legalization. And I actually back then, to tell you how little I knew about it, other than the obvious rightness of the cause, I kind of mixed up the terms decriminalization and legalization. I didn't understand there was actually a difference because it kind of sounds the same. But that article, I figured I was just adding my name to the many doctors who have come out and spoke in favor of this issue. And I assume there must be many doctors because most of my friends who are doctors say that absolutely this drug should not be against the law. And so that's the article I wrote. Wall Street Journal fortunately picked it up, and I got my 15 minutes of fame that then led to a lot of requests for speaking engagements on behalf of other drug policy organizations like the Drug Policy Alliance and MPP, Marijuana Policy Project. And in 2014, I was asked to join the coalition of the NAACP, the ACLU, and other New Jersey organizations that were looking to legalize adult use cannabis in New Jersey. And I'll tell you the path, both chronologically as well as in its character, has been similar for New Jersey and New York, and I'm still not sure who's going to come out and be first to the market on that one. But when that coalition got started in 2014, I was going to represent the doctors, and I was going to get all my friends to sign on, and we were going to, speak with one united voice, and only to figure out that none of my doctor friends wanted to get their name on record about this, and it was very disappointing. So I knew that there were doctors out there who would be willing to say something. And so I looked for the national organization that would represent us and that I could hook up with, and figured out, surprisingly, there was none. There was no organization of physicians, a national organization that actually supported legalization. Zero. The closest we had was the California Medical Association had endorsed legalization in 2011. But now in 2014, it was time to start organizing. And so, after weeks of doing Google searches and scratching my head and talking to my wife about how there's got to be this organization, never found it, and decided, okay, took a deep breath and said, "Okay, let's make an organization." So fast forward, and in 2016, we launched with 50-some prominent doctors from around the country, including former Surgeon General Joycelyn Elders, who's one of my personal heroes, and she has been very active in the organization, actually, as an honorary board member. We also have Andrew Weil. We have the former clinical head of SAMHSA. A lot of former people in positions, because when you are in the organized medicine world, you consider cannabis to be a political third rail, and it still is. And actually, this last Sunday, I was at a dinner with some of the prominent physicians in New Jersey, and speaking to the head of the main medical organization in New Jersey, which I will not name out of courtesy to him, and because I do want to talk to him rather than talk at him. So if this gets back to him, give me a call. He was saying that, yes, we issued a white paper against legalization, but we don't take a position on criminalization. And to which I responded, basically bullshit. You do, because you are saying that this drug should be against the law, despite all of the harm that that the prohibition has done, despite the fact that the prohibition is so much worse than the drug itself. And I kept his feet to the fire and made sure that he understood that there is nothing that limits people's access to health care so much as poverty. And there are few systems in this country that has created more poverty than the war on drugs. And so that's what I'm in it for. That's why, a country doctor in Princeton, thank you. That's what got me into it. It's a real passion because, as I've said in many forums, including testimonies at state legislatures around the country, this is the wrong drug. This is not a close call. Oprah says things I know for sure. Well, one of the things I know for sure is that regardless of what regulation should look like, this drug should not be against the law. Now we can talk about details. Yeah. And so Doctors for Cannabis Regulation launched with our Declaration of Principles that you can see right here. It is available online at dfcr.org. We also have our, this is a fixed document that now is hopefully the stuff of history. We have our Declaration of Principles, our platform of regulations, which is a dynamic document that we change based on internal discussions and feedback from doctors and other stakeholders around the country. There are 7 points here. The first 3 of them are the public health issues, the obvious things about oversight of production and testing, distribution and sales, labeling, proper labeling, targeted prevention of non-medical underage use, and then that's the first 3. The last 4 are about social justice issues, including taxation of the adult use cannabis industry to fund equity programs for communities disproportionately harmed by the drug war. You might be familiar with some of the demographics that are involved with that. Protected rights for limited home cultivation, which unfortunately has been a non-starter in New Jersey, and I believe it is also here in New York.
No home
grow.
I think it's...
Yeah.
I don't think it's public, but I don't think it's like a secret that some of the conversation has been around potentially staggering.
Yeah, okay.
But not ruling it out entirely.
Okay. Yeah. And I can talk about, if we get to it, I'm happy to talk about the dynamics of that conversation in New Jersey and why it is that my organization, despite one of our 7 principles not being met, still supported the Senate bill S2702 that did not include home cultivation, but we supported it anyway. We also support expungement and resentencing for all cannabis arrests, charges, and convictions. And of course, the last and perhaps most important point is ensuring diversity in the industry. It is not enough to say that we are going to legalize this and now communities of color are going to be fine, because this could be yet another industry that is that people who come from modest means will be shut out of. And so I think it's a great thing that the sentiment around the country, and one of the key issues to get cannabis legalization passed around the country has been ensuring that there is some diversity in the industry. And I know that is a hot topic here in New York as well. And it's a process that actually DFCR has been involved in. We have 2 states, I believe, where we have an actual state campaign committee, and New York is one of them. Tanya Adams, of course, is involved in that. And the chair of that group, that committee in DFCR is Dr. Julia Arnsten. Do any show of hands people know who she is? A remarkable woman. She is a professor in 3 different departments at Albert Einstein Medical School, medicine, psychiatry, and epidemiology, which is a very qualifying department for her. She's also the chair of medicine, or at least she was, I believe she still is, at Montefiore Hospital, and created the first cannabis clinic in the country for indigent individuals, and got 4 or 5 physicians to work with her on that. She's also done some research in the field looking at, for example, and I had a conversation with one of you out there about this today, how people who are leaving rec dispensaries in legalized states are happy to share with you the medical conditions for which they're using cannabis. And so when people say that, they're really, it's all just an end run, or the medical thing's just sort of a Trojan horse for legalization. Well, legalization is supported by all the medical cannabis organizations, and that is because of the degree to which it does improve patient access. So we're, of course, about patient access, but the real man bites dog story about DFCR, and the reason that we've been fortunate to get a lot of public notice, is the fact that we are a bunch of doctors who are saying, yes, this drug can be harmful in certain circumstances, but by no means should it be against the law, that there is no question that slightly superior to prohibition is decriminalization. Way superior to both of those options is legalization and regulation. And we know this because what's happening now with this vaping issue and the illnesses you're seeing have been with unregulated products. And we even heard the former head of the FDA just recently say that, don't want to legalize it, but we might need to regulate it. And that's good news, because if they don't realize that you have to legalize it to regulate it, that's fine. Just call it regulation.
And if he wants to speak at CannaGather and not charge us what he has to charge us, we would love to have you.
I think that was Scott Gottlieb, if he is...
I won't share how much. I was like, what? I mean, he probably deserves it for certain companies, but we don't have the money. So.
But you got me instead.
Oh, this is just
I work cheap.
Yeah, we had a deal. We had a deal.
That's right. That's right.
Grandfathered in from.
And it was actually at High NY, which is an organization.
I don't know if we're legally allowed to say that name anymore.
No, we're not. Okay. In that case,
yeah.
we were with an organization from which CannaGather grew, and we.
It's a more complicated, sinister story, but he knows it and I know it. So
you
we
were
don't have to
there,
talk
right?
about it.
And so we will say we launched at your event in 2016 with the publication of our Declaration of Principles, and we had some of the most prominent cannabis doctors in the country, including Dr. Julie Holland, who's right here in New York City, author of The Pot Book, and we had Sue Sisley, who has been one of the strongest members, board members, and now honorary board members of Doctors for Cannabis Regulation. And she's still making history. And I can talk a little bit about what we're doing other than testifying all over the place.
Sure. So if you're not familiar with Dr. Sisley's work, definitely check it out because she's awesome. She lives in Arizona, but she comes to New York once in a while. I think she's coming in November, so I need to follow up with her. But she's awesome. Definitely take a look at her work. Definitely, I think there's definitely a lot of overlap in terms of like the social equity, legalization stuff that I want to chat about with Adam. So this is like a perfect setup. And then at a high level, definitely share with us like what you guys do at DFCR. And then you had a very unique experience. So as mentioned, like he testified in front of Congress. And I was just finding out, like, not just as a viewer in the live stream, but like, hearing it from you, what your experience was like was very eye-opening. So I think like that is a very fascinating experience that I think everyone wants to hear about.
Sure, absolutely. That experience was second only to our NFL campaign, which is the only thing that you guys might not know about that we're doing. We're organized with NFL players, and when it comes to the media, they open the door and let us come through with them, and so they've given us a lot of airtime. Second only to that, in terms of media attention, has been the testimony we've given in many states and now in the U.S. House of Representatives. Judiciary Committee that had its first ever cannabis legalization hearing a couple months ago in July. And it was organized by Chairman Jerry Nadler, who, if you get him here, that'll be fantastic.
The plan is tentatively in December.
Wow.
Congressman Nadler and State Senator Savino will be our speakers.
He's the man. I mean, he's the one really making this happen. It took about a year to get that hearing to happen, and there were 4 of us who testified. And it was a great opportunity for Marilyn Mosby, who is the state attorney for Maryland, Neil Levine, who is the head of the Cannabis Trade Federation, and Dr. Malik Burnett, who is a former board member of DFCR and, of course, a well-known and really powerful advocate for legalization, social justice, and public health. And so at this hearing, we got our 5 minutes to say what we needed to say, which is all the things you might imagine that I would say. And then it was very interesting to hear what the questions were. A lot of them were, of course, softball questions, because it really, there's a real sense of bipartisan support. And I think it was not around the MORE Act that Chairman Nadler is sponsoring, which, that's an uphill climb to get that through. And I understand policy organizations, as you were saying, are holding off support of the Safe Banking Act until we can see what we can do with that. Well, I personally and DFCR officially has endorsed the Safe Banking Act as a necessary intermediate step. Anything we can do to chip away at the prohibition and also to make the industry safer. Carrying around bags of cash is not necessarily the way to go. Of course, we also want to see the end of 280E, and if you guys don't know what that is, talk to Ms. Sullivan right here. She'll give you an earful about that. And by the way, thank you to ArcView for having supported DFCR in the past, and we'd certainly appreciate your help going forward as well. I guess the one hostile question that I got that was right out of the talking points of smart approaches to marijuana, people familiar with Kevin Sabet's work against legalization?
So smart approaches to marijuana is the leading disinformation campaigner when it comes
ironically
to cannabis.
Smart approaches to marijuana.
Yeah, they actively distort statistics to create basically the modern incarnation of reefer madness. Fortunately, they've actually flipped a couple state legislators in New York State who were on the fence about cannabis legalization because they pushed them to actually do their diligence and get involved in the statistics because of their attempted shock and awe campaign. And then when they actually did the diligence, they were like, oh, you guys were lying to us. That's pretty messed up. And now they support cannabis. And I don't want to say which state senator it is, but thank you, Kevin Sabet, for helping with legalization in New York State.
Yeah. Fair enough. But not to say that they did make a dent here, and I think that's important to point out.
They definitely do.
Right. And what they did was they went upstate. And they talked to people in the rural areas of New York, and this gets into the details that is beyond the scope of this discussion. But the tension between trying to ensure good social justice provisions and getting a bill that's going to pass. And, a tricky thing, for example, is that in the rural areas of New York, it's a very hard sell to say that a percentage of the state sales should go to areas disproportionately affected by the drug war, because that's in the cities, and there are poor folks in the country, and so it's just not as simple as directing those funds. I'm not saying that I know a simple answer to that, but it's something to think about. And when it comes to home cultivation, then there's another thing that, is this the hill to die on? We have a character, a great guy in New Jersey that many of you may know, probably personally, because he really gets around, is Leo Bridgewater. Great guy, one of the key people in Minorities for Medical Marijuana, which, along with the Minority Cannabis Business Association, two great organizations trying to make a difference for communities of color in the industry. Leo, when I asked him about his support for the bill, said, I just want him to stop arresting my friends. He said, at this point, I'm ready to support it because, we can't let perfection be the enemy of the good. And so we all have to be mindful that there's going to be a tension. And I suppose it's one of those situations that if it's done properly, nobody will be happy. But what is most necessary is that we get this done so that the people of New York can see that, guess what? The sky doesn't fall when adult legalization happens.
Yeah, I guess I'm the only one snapping because I'm talking to state senators and they're like, the sky's going to fall, the sky's going to fall. And I'm like, I don't know, Colorado's still there. I definitely appreciate where they're coming from because it's a scary thing. And I think that the social equity stuff is very, very important and it's necessary. I think it's less of the obstacle to legalization than it is this consistent disinformation from the past 70 years that people like Sam have been doing in terms of making people think that if you legalize, the sky is going to fall, which we all know it is not, because if sky falling and cannabis consumption were correlated, let alone causation, like the sky would have fallen a long time ago in New York, and it's still up there somewhere. It's dark, so I can't see it. But
I'd love to hear what Adam has to say on this and other issues, but that's something I'd like to kind of tip you guys off on as you're going out there and talking to your friends about the merits of policy change, is that what organizations like Smart Approaches to Marijuana is doing is that they are finding the problems in each of the legalized states. And there are problems, not surprisingly. Every state has had stumbles in the process of legalization. Beats the heck out of mass incarceration, I would argue. But each of the states, you can find something. The persistence of the illegal market in Colorado, the oversupply in the Pacific Northwest, and the negative consequences of that. You can find that. But most of what Smart Approaches to Marijuana will tell you about is issues that are not related to legalization or regulation, but rather the lack of regulation. When there have been lapses in the regulation, that's what they're actually picking on. And so when you hear them say, this happens and that happens, and there were 100,000 edibles recalled in the state of Colorado in 1 year. And I'm thinking, yeah, I guess it was probably a lot of one or two products, it was probably those kind of numbers. That was products, not numbers of recalls. But there have been recalls, and you know what? Awesome. That is great news, because that means they're actually regulating the industry for, finally. And so that's the kind of thing that you want to share with them. The last thing that I'll leave you with is when you hear Smart Approaches to Marijuana say that, in Colorado or in California, cannabis users, all their fingers fall off or something like that. Where they're getting that data from is mainly one source, which is the Rocky Mountain High Intensity Drug Trafficking Area, Rocky Mountain HIDA. And so if you're ever up against somebody who is quoting these statistics, ask them where it came from, because I bet you somewhere between 30 and 60% chance it's from this one organization that is a group under the DEA, and their sole mission is to prevent the spread of so-called illicit drugs, and that means they are, by their mandate, required to oppose legalization. So your tax dollars at work, folks, and make your opinions known on that. So I really appreciate, with industry here, I appreciate the fact that you guys are supporting advocacy. Of course, we're making it possible for you guys to be in business, and so I do want to make a pitch and say if it's at all possible for people here to support organizations like my own. We work almost entirely on volunteers, and any donation, the bigger the better, will really help keep our doors open, because we are out there, we're working hard, we're not getting paid, and we are really relying on you guys to make it possible. So thank you very much.
Round of applause, Dr. David Nathan. Nice battery. Are you going to stick around a little bit afterwards for questions? Amazing. Great. I think, a key point there is when it comes to disagreements with folks who are against legalization, a lot of them cite medical points that don't come from a source that's a doctor. But he's a doctor. He does this. And so do his colleagues. And they support cannabis. So thank you for doing the research and showing that legalization is the right way.